So we can help them out with that, and we work with a company out of Florida that will send those over to these different countries and get that taken care of. So we've placed a lot of internationally, which we would prefer to place most of ours in Oklahoma, because a lot of families want to meet their recipient, and it's a little bit impossible when they live in Spain. But we facilitate some letter and some correspondence that way, so they get a chance to talk to whoever the recipient was. Right now we have 2 researchers that we work with. One is at OU and one is at Dean McGee. Dr. Weichman is at OU, and he is doing research on how to repair cornea after a cataract surgery in diabetic patients, or not in diabetic patients, just corneal. I'm sorry, stop. He's doing the epithelium regeneration. And so that would be a way at some point to where they may not need as many cornea transplants. I don't know that it would happen anytime soon, but that's what he's working on. So we give corneas to him when the patients are too sick to be transplanted, and that we wouldn't want that to go with into a recipient that could possibly acquire some sort of disease that would not be good for anybody. So Dr. Karamichos is at Dean McGee, and he is the one that is doing research on the corneal wound regeneration for diabetic patients. A lot of times when you have a cataract surgery, they make an incision in your eye that is about 3 millimeters, and in diabetic patients, it's hard to heal a lot of times. And so he's working on different antibiotics and things that he can regenerate that, and that the wound would close up a lot faster. I've talked a little bit already about the change in our domestic versus international. What we have done since Dr. Stone has been gone is Dr. Satowski is our other co-medical director, and she's at Dean McGee. And so she started using us for her surgeries, and then there's a new doctor there, Dr. Jennifer Wu, and she started using us more. So we're getting, the last couple of months, our surgery schedule's been a lot more full than it has the first part of the year. And it's mainly because of Dr. Satowski and Dr. Wu. So what we're hopeful is that we can just hang on until Dr. Stone gets back, because he was doing about 7 to 10 surgeries a week, which was great because when we had all these corneas, we could just drive them down the street to him, and then these were local patients and the families could meet. And so we're hopeful that, for the next year, we're just going to keep doing what we're doing, and then when he gets back, it should even out a lot better. But we have about 6 doctors here. Dr. Satowski's in Oklahoma City. Dr. Conley works out of Tulsa and Muskogee. Dr. Goldberg is out of Tulsa and Muskogee. Dr. Wu, Oklahoma City. Dr. Taylor's out of Oklahoma City. And Dr. Miller is in Duncan. He uses us maybe twice a year. And then there's a Dr. Bellardo in Oklahoma City. He uses us about twice a year. So we're doing fairly well with the number of surgeons we have, because there's a limited amount. We pretty much have captured all of the ones that actually do cornea transplants. Not every ophthalmologist does that. You have to be referred to a specialist. One thing we're looking at doing in the future, there's a new type of surgery called a DSEC, and it's been around for about 5 or 6 years, but it's become a lot more popular. And so in a normal cornea transplant, they transplant the entire cornea. They just make an incision, remove your cornea, and put the new one on. Well, in the DSEC, they take the cornea and they cut it horizontally. So they're only transplanting the back 2/3. And what they do with that is they make the incision the same way they do with a cataract surgery. So it's a very small incision. So it's a faster healing time, and it's just overall better for the patient. And so they fold the cornea kind of in half like a taco and slip it in, and then all you have is that's the only part of the new cornea you have. And so it's become quite popular, and in fact I looked on some statistics the other day, and it has risen about 50%, whereas PKP, which is a full thickness, has dropped about 50%. So they're kind of switching them. The problem for us is we don't have the equipment to cut those. And so I think in the future, what we've talked about, and I've talked about with the board, is trying to raise about half the money that we would need, which is probably going to be between $75,000 and $100,000 for the microscope, and we have to convert one of our offices to a clean room. But if we could raise half the money, then we can apply for a grant with Alliance International for the other 50%. And I would think we would probably start to do this in about 2 years, because since everybody is so new, I don't think it would be prudent to overwhelm them with a whole lot of new procedures that they're just now getting comfortable with the ones that we're doing right now. And that we'd also have to hire another person, because you have to have a circulator and a person to use the microscope and the cutting machine. So there's a lot that's going to go into it, but that's something that you can expect in the future, because right now what we do is we will place a cornea with one of our doctors that does a DSEC. We have to ship it to Kansas City to be cut, and then they have to ship it back. And so it takes about a day or so, 48 hours, to get all that taken care of. And so this would cut down our time, and every tissue needs to go out as soon as it can. We have 14 days to use a cornea, but most doctors in the U.S. only want to do 7 days. And so after that, a lot go internationally. But Dr. Satowski in particular, she would like them 2 days old if you could get them. But that's not always feasible, because we have to test blood and we have to get medical records, and there's just a lot that goes into it. So I put pictures of the staff. These are all the new people.